If you haven't heard about Morpheus8 or other radiofrequency with microneedling treatments, I don't know where you've been, because these treatments have become so popular that we get requests for information about them all the time. So in this video, we decided we would go to the experts to ask all of the questions that you guys have sent in about Morpheus8 and very similar treatments to it. For this video, we decided to reach out to two of my favorite board-certified dermatologists, Dr. LINDSEY Zubritsky and also Dr. SHEILA Farhang. I'll leave all the information for their social media and where they're located in the caption below so you can look them up, because they're in two different parts of the United States. Now, I want to put out there, radiofrequency with microneedling treatments have been around for a while. This is not something new at all, but it has gotten way more popular, and I think it's because of a treatment called Morpheus8. There was a second there where I feel like everyone I talked to in Los Angeles was like, oh, I just got a Morpheus8 treatment. Oh, what do you think about Morpheus8? Oh, I get Morpheus8 done every single month. I was hearing it so much from people that I started wondering if I needed to get it done. And of course, I would have made a video about it to show you the whole process and the whole treatment. But when I started talking to dermatologists that I love and I trust, especially the ones that know I deal with melasma, everybody told me not to do it. And it's not because people with melasma can't get this treatment done. It's because of my past history with my melasma and how my skin has reacted to even just simple microneedling. And so anything that might involve heat or even puncturing my skin could potentially be disastrous for my melasma. So I'm going to stay away from this treatment. But in talking to Dr. SHEILA Farhang, she actually said that people with melasma can get this treatment done. Honestly, it always just depends on the professional that you go to and how well they know the device and how well they know your skin and how well they know how to treat melasma. Obviously, just like Dr. Farhang said, there are little things that they have to take into account, like the depth and the heat level and everything. So you really want to just make sure that if you deal with melasma, you're going to someone who understands that. Now, one of the reasons why this video is especially interesting to me right now is because with the rise of Morpheus8, which is basically what I'm going to focus on for this video, even though really we're referring to most radiofrequency plus microneedling treatments, there are just other brand names out there. Morpheus8 seems to be the most popular. And with its popularity has come the negative videos now on social media, like on TikTok and on Instagram. There was one where I saw a woman who had such a bad reaction to Morpheus8. And I think I've seen so many videos where people talk about how painful it is and it's not worth it to them. And it leaves just bad reactions and just terrible results and everything. So now I'm starting to see the flip side of everyone just raving about it. Now we're starting to see like, okay, there are people who also hate their experience. So I thought we might want to get into all of these details. All right, so question number one is, what is Morpheus8 and what are the benefits of combining radiofrequency with microneedling? Because it almost feels like it's a lot at one time.
Combining radiofrequency with microneedling is much more effective at stimulating collagen production than microneedling alone. Microneedling induces tiny microtraumas in our skin, which cause our body to go into a natural healing response, which brings in skin firming proteins. Microneedling alone does help with fine lines, wrinkles, scars, and stretch marks, but adding radiofrequency gives it the ability to go deeper into the skin, which helps to better firm and tone the skin.
Radiofrequency is a really great technology to help stimulate collagen. And by using microneedling with this device, it is emitting at different depths. So for instance, the Morpheus device for the face goes down to 4 millimeters. That is where something called the fibroseptal network is. And that is basically contouring some of that fat and that fibrous tissue in order to really tighten the skin. And this is where I like to target some of that deep acne scarring. This is where I like to contour and go in fix mode and really contour and remodel some of that adipose fat tissue. And then of course we like going 3 millimeters, 2 millimeters, 1 millimeter, and then you can go 0.5 millimeter. And at 0.5 millimeter, this is where you can address some of those fine lines, the dullness. And so in general, based on what you are targeting and the depth of it, there are tons of different types of skin benefits.
I think the question that we get the most is, what kind of results can you expect from this type of treatment?
When getting microneedling with radiofrequency, you can expect to firm, plump, tone the skin in addition to improve fine lines, wrinkles, acne scarring, other types of scarring, stretch marks, and improve the overall texture of the skin.
Next question really is Morpheus8 any different from the other brands that are on the market?
There are quite a few radiofrequency microneedling devices out there. I would say the InMode one with the Morpheus is pretty robust, and that is because of the bipolar technology, which means that it keeps the heat kind of circular inside the device, and that's a little bit more just scientific versus a monopolar. And the bipolar is nice because you can go higher heat, higher energy, so more output without that tissue damage. And then also the depth that it goes. So with the Morpheus device, it goes 4 millimeter in depth. So that's how deep the face handpiece goes. And that's really nice because that's where the fibroseptal network is, where we can remodel that adipose fat tissue. So for people that want to come in and get a snatched jawline, that's not going to work if I have a device that only goes 2 millimeters. I may work for some, fine lines and things like that and a little bit of tightening, but I want something to go pretty deep and to really be effective. And for the body handpiece that they have, that goes 7 millimeters. So I really kind of want that burst of heat, and they have a burst mode where it's like 7, 6, 5, 4, 3, 2, 1 to create that column of heat.
So now that we've heard all of the benefits that you can get from this type of treatment, the next question really is, who's the ideal candidate? Who would be the person that benefits most from it?
RF with microneedling can offer benefits for most people. It's generally considered safe for all skin types, colors, and tones. It's really recommended for those people who have aging skin or are concerned with sagging skin, who are looking for a more lifted appearance. I typically recommend it for patients who are 30 or above, who are looking for that more toned, lifted, firm look, who are looking for skin rejuvenation, or who are just looking to improve overall tone and texture of the skin.
Radiofrequency Microneedling was actually the first device that I got at this office because I was able to treat several different things. And I was able to, versus lasers, treat darker skin types and those that were tanned or sunburned. I would say that this device, so radiofrequency microneedling, this technology is really good for those that want to invest in their skin. It's a little bit more of a marathon. It's not like you're getting cheek filler or getting a facelift. It stimulates collagen. So it's really great for those that want to treat laxity, that want to tighten, preventatively treat laxity. So those in their 20s or 30s that are starting to get some laxity. Those with acne scarring, and then acne too. We're actually doing a clinical trial on helping acne. And then also those with fine lines, because toxins, Botox, Dysport, Xeomin, it doesn't actually treat your fine lines. What it does is it helps kind of put a Band-Aid on it and helps prevent it from getting worse. So it doesn't actually anti-age and stimulate collagen. Botox doesn't do that. And what I love is that it is colorblind. Radiofrequency is colorblind compared to lasers, where lasers are targeting pigment. This does not do that.
And of course, you heard that I don't plan on getting any of these types of treatments done due to my melasma and also my past history with just my reactions to treatments like microneedling. There are probably other people who are also not good candidates for it. So let's hear about that.
Well, most people are great candidates for radiofrequency microneedling treatments. There are a few contraindications. So those that are pregnant, breastfeeding, those with a type of connective tissue disorder, scleroderma, lupus, and this is why it's really important to get these treatments under the care of a doctor so we can screen those. Active infection, keloiding, you got to just be really careful. African American types, you have to be careful. You can't go high heat. You can't go really superficial. In general, I would talk to your provider regarding if you are or not a candidate. If you've had Botox filler, that's totally fine. If you've just had threads, I wouldn't recommend it.
I also don't recommend this procedure for those who have extremely lax or sagging skin, or those who are looking for facelift-like results. With radiofrequency, with microneedling, you're just not going to get the same results as you would a facelift.
I think the question that I'm the most curious about, because I have seen so many videos about people asking if it's painful, is does it hurt? And also, what is the downtime that you can expect?
The biggest negative side effect to this procedure is pain. However, with proper technique and appropriate numbing, the pain is rather tolerable and most people can safely get this done. Immediately after this procedure, you may notice some redness, swelling, or some tiny needle marks. These tend to dissipate within the next few days. You may still have some erythema or swelling on the skin, as well as some mild flaking, but typically the downtime is considered minimal and you can resume normal activities pretty quickly after the procedure. There is very little chance of permanent scarring, although mild swelling is relatively common. That typically goes away within a few days.
The downtime after an RF microneedling procedure really does depend on your skin type, your sensitivity, how aggressive your procedure was. So in general, though, I would say that you're pretty pink, maybe swollen the next day, and then you may get some flaking. I would not schedule anything for about a week afterwards. That's usually the time my body, and I have really sensitive skin and I flake a lot. So I give it about a week. After a week, all my flakies and scalings are gone. My swelling has subsided. But some people are like up and out the next day. For your first one, give yourself a few days to a week. Don't schedule anything for a week, but you can definitely go to work the next day.
And then I've seen so many people ask this, do you have to get more than one treatment done, or is one treatment going to give you some real results?
I typically recommend between 3 to 4 sessions of radio frequency with microneedling. You likely will not see results with just doing one procedure. It does take several months for your skin to build up collagen, so you're not going to see results right away. It does take 3 to 4 months until you start to see those results from your first procedure.
And then going back to a couple of those videos that I saw on TikTok where people were talking about their negative results from Morpheus8, I decided to ask Dr. Zubritsky and also Dr. Farhang about what they think might have happened.
So I was debating to even make a TikTok, but I didn't want to come on here and just talk about my own personal experience with Morpheus8. This is not what my face normally looks like. I pretty much went from this to this in less than 24 hours. So I'm an aesthetic provider, and I was thinking about bringing Morpheus8 to my practice. And I'm a firm believer that if I'm recommending something to a client, I want to be able to speak on it from my own personal experience. The Morpheus8 machine was brought into my office so we can do a demo and try it out. I was a little skeptical because I heard it was really painful, and they assured me that it's actually really pain-free. And I will say, we used 30% lidocaine. I didn't feel a thing. However, it's what happened after that really made me worried. So this is what I looked like while I was doing it. As you could see, wasn't in any pain. And then this is what it looked like right after. Totally fine. Definitely normal and definitely what I expected. Then a few hours later on my way home, I started to see a little bit of the marks on my face. And this is what it looked like. Then later that night, I looked in the mirror and I'm like, oh, okay, this is now what it looks like. I took 2 Benadryls, went to bed, woke up the next morning, and then this is what it looked like. Naturally, I was a little worried. I had to cancel my clients for the day. I just did not feel comfortable being out in public. I had to walk my dog with a mask on. And this is then what it looked like a few hours later. I'd say this was probably the peak and the worst of it. And then I decided to take some prednisone.
While swelling can be normal after this type of procedure, this radiofrequency microneedling, the type of swelling that patient had in the video was a little bit more than the usual. And this could mean many things. Some people just swell a lot after procedures. This patient, I think, was a cosmetic provider, so she probably knew if she's an excessive sweller. Some people, I just start to do a little bit of filler, something very minor, or I just put numbing on and they just start to swell. So I can't really say why this patient specifically had this robust swelling of her face. It could have been an allergic reaction. Maybe something was applied afterwards. Maybe she was allergic to the numbing. Maybe she has some type of connective tissue disorder that she doesn't know about, but I can't really diagnose or anything. Thankfully, I think she's okay now. And I would say in those areas, if you're very, very sensitive, you can always do a test spot if you'd like. Just talk to the clinic that you're going to. And if you have a bad reaction, you don't want to continue your second and third, I'm sure something could be worked out.
When performed under the correct settings, under someone who has proper training, as well as under the supervision of a board-certified dermatologist or board-certified plastic surgeon, the risks involved with this are very minimal.
If you're thinking about getting Morpheus8, and if you're like, I don't know what that is, let me educate you. It's a machine that does all this fun stuff, tightens your skin, makes you look amazing. You have to get it 3 times. It is hands down the most painful thing I've ever done. I literally bawled my eyes out. I hated the whole experience, but I was like, this will be worth it. I'm going to look gorgeous soon. Where do I even begin? There's so much to say. My other friends that have gotten it, they look stunning, amazing. Their skin looks so tight, so snatched. They also got laughing gas when they got it. So they said, wasn't that bad? The pain wasn't that bad. I was only numbed. Literally, I was bawling my eyes out. I had to actually stop. I couldn't finish. That's not even the worst part. The worst part is that for some reason, my skin reacted in a strange way. And let me just show you. If we zoom in here, you can see all of this texture on my forehead. It literally, you can see where the machine went in all over my neck. It's been 3 months and I don't think it's going away anytime soon. I don't know. I would just say test your skin, do like a mini test, because this has been part of the reason I don't post on TikTok anymore, because I look like I have goosebumps on my face.
Number 1, pain. So pain is a very kind of subjective thing. However, there are certain places that I feel like don't numb enough or don't numb appropriately. For instance, if they're not using a numbing agent that is strong enough and they're only using it for 10, 20 minutes, that is not enough in order to numb for this type of procedure. That is, microneedles with heat. So it can be a very uncomfortable procedure if you're not numbed appropriately. We like to use a very potent plasticized gel base, numb the face for at least an hour, take it off in sections. And I also like to do nitrous oxide for my patients, which is laughing gas, and they're just having a grand old time. Okay, number 2, there was a gal that was talking about some grid marks and bumps on her face, and I feel so bad for her. I'm so sorry that you went through that or are going through that. This may be attributed to a few things, either connective tissue disorder that's not known, possibly some type of topical that was applied after the procedure and that person's getting a reaction to that. We've seen that quite a bit. So whenever you're getting a procedure that creates microneedles, microchannels after lasers or radiofrequency devices, you have like open channels in your skin. So you have to be really careful about what you're applying on the skin. People think, oh my gosh, let's put all the anti-aging things on there because it's going to be absorbed better. But in my practice, I'm like, keep it simple, babe, because we do not want any of those preservatives, those actives. There have been tons of published reports on granulomatous reactions after microneedling type devices, after people have applied like vitamin C on the skin. So you just really want to be careful. And again, you want to go to a place where they really know the skin. It could be that the skin wasn't cleansed properly and some of that old makeup or sunscreen or numbing was basically like driven down into the skin with the procedure, and that can create those bumps as well. So that's another thing. And then with the grid marks, that may just be high energy or high heat, more than the patient was able to tolerate. So that may be closer to like maybe burn marks.
So that is Morpheus8. If you have any other questions, you can ask in the comments below. I'm sure one of the professionals will maybe get back to you. I can even reach out and ask them further questions, or even people who have had experiences with this type of treatment can sound off in the comments below. I'll also put Dr. Zubritsky and Dr. Farhang's information in the description box in case you want to find them, and also reach out to them with questions about this treatment as well. You can find me on Instagram and on TikTok and on Threads. I'm at Susan Yara, and I'll talk to you soon. Bye.